Hello guys, welcome to my channel. Today we are discussing one of the important system, and we are starting it, cardiovascular system. In that first module we'll see about atherosclerosis. First, what do you mean by athero? Athero is just a artery or a blood vessel. Artery uh, or an artery. Blood vessel or an artery. Sclerosis means thickening. Thickening means we'll write definition. It's a thickening of blood vessel. Thickening of blood vessel or artery. Why the blood vessel or artery is getting thickened? It is due to the deposition of fat. Due to deposition of fat. Guys, before going to pathogenesis of this disease, we'll first look at the risk factors involved. Risk factors. We'll classify them as modifiable risk factors and non-modifiable risk factors. Modifiable risk factors, non-modifiable. Modifiable and non-modifiable risk factors. In the modifiable risk factors, we have to remember three things. First is diabetes. Second one is hypertension. Third one is obesity. Guys, see, imagine if a patient with diabetes, if he is regularly monitoring and if he is regularly maintaining his blood sugar levels, blood glucose levels, he is at a less risk of getting atherosclerosis. Same with hypertension. If the patient is monitoring his blood pressure and if he is well maintaining his blood pressure, he is at a less risk of getting atherosclerosis. Obesity, guys, it's a major threat, we can say, in younger generation, right? It's a major concern. Now, in the non-modifiable risk factors, we have first one is age. We cannot modify age, right? Then gender. It is said that older males and females are more affected in the atherosclerosis disease, and even in the very young aged, very young age. And it is also said that women at reproductive phase, women at reproductive phase are less prone to this disease. Why this might be, guys? This is due to estrogen secretion in them. Increased estrogen. This estrogen will prevent women at reproductive phase from atherosclerosis. It can come as MCQ. Just remember this. Now we'll move to pathogenesis. Imagine if this is endothelium, if this is blood vessel, if this is blood vessel and this is endothelium. One of the risk factors we studied is hypertension, right? Let's see how hypertension is inducing atherosclerosis. If there is persistent hypertension, for many years, say about 10 to 15 years, If this is the case, imagine here there is increased blood pressure, and imagine if this is endothelium. If this is endothelium, this persistent blood pressure or increased blood pressure will damage the endothelium, and endothelium will look something like this. It is damaged endothelium. See, chronic hypertension is causing damage to the endothelium. What this damage will do, there will be spaces, right? From the damage, from these spaces, fat will enter. Entry of fat will enter. And remember guys, fat will be identified as a pathogen in the body. And if it is chronic hypertension, there will be chronic diseases, no? See, atherosclerosis is a chronic disease. Remember this, it is not an acute. It cannot happen in within some days. It will take time. And if this is the case, then there will be entry of monocytes first. What these monocytes will do, these monocytes will become macrophage. We know, no, this is the cell of chronic inflammation. It's the cell of chronic inflammation. What this macrophage will do, this will phagocytose fat molecule. I said no. Fat will be identified as a pathogen. So my macrophage will phagocytose the fat. This is not a concern. See, if you get a patient with only hypertension, he is not at a risk. He might be, but you cannot suspect atherosclerosis in him. If the patient is only hypertensive, if the patient is hypertensive along with obese, if the patient is hypertensive along with obesity, then it is the concern. See, I said no. If the patient is hypertensive along with fat, obesity, there will be deposition of fat. See, the fat is getting deposited in the endothelium. This fat will be phagocytosed by the macrophages. Now, first there was increased blood pressure. This caused, what this pressure did, damage to endothelium. What this did, what happened next? This damage to endothelium led entry of fat molecules. This fat entry activated macrophage. Also, it will increase the interleukins. What these interleukins will do, this will necrotize. This will cause necrosis, tissue damage. We know now guys, in a chronic inflammation, what is the hallmark of chronic inflammation? Hallmark of chronic inflammation. Yes, it's tissue destruction and healing by fibrosis. Tissue destruction and healing by fibrosis. Healing by fibrosis. See, if there is a tissue damage, it should be healed by fibrosis, right? Yes, should be healed by fibrosis. But what is the problem? Endothelium don't have any fibers. Then what happens? We'll see. If this is the endothelium, there was damage to the endothelium. It was damage. So before this, guys, we know the layers of blood vessel, right? First is tunica intima, then tunica media, then tunica adventitia. Tunica intima contains endothelium. Tunica media contains muscle fibers, right? Muscle fibers. There will be layers of muscle fibers. Between tunica intima and tunica media, let's take only this layer, 2 layers. Between tunica intima and tunica media, there will be a lamina called internal elastic lamina. This is internal elastic lamina. What happened now, guys? First we'll write all the things which are at their work. First, what was there? Fat came. Fat molecules are present. Along with fat, there is a macrophage. There are macrophages. Along with macrophage, there is necrotic area, right? There is necrotic area. There is necrosis. This necrosis is tissue damage. This should be healed by fibrosis. Let's see what happens. I said no, endothelium is not having any fibers, so this will take fibers from the muscle. So there will be muscles surrounding this. What happens next? This is muscle layer. This is macrophage. This is fat. Necrotic area. What happens next? Once there is formation of muscle layer, there will be, above that, there will be formation of endothelium. This is endothelium. We'll call this as fibrous cap. Remember this. We'll call this as fibrous cap. See, guys, previously endothelium was like this. Blood vessel was like this. Now it became like this, right? So now what happens? There is narrowing of lumen, right? This is what we were talking. We wrote in the definition. It is thickening of the blood vessel or an artery. See, any wound healing will ended as a scar formation, right? This chronic inflammation is healed by healing and fibrosis. Fibers came from muscles. So this wound heal once the wound is completely healed, then it will be present as scar, right? Scar. We know this. Any tissue damage, any healing will not be 100% strengthened like as it was in previous. So what happens, this will cause a weakened area. This scar will remain as weakened area. This will be weakened area. Okay. Guys, see, we'll write components of atherosclerosis. What are the components? New intima, right? There is formation of new intima. This is new intima, right? Endothelium. New intima formation. One is new intima formation. The other one is atherosclerotic plaque formation. See guys, I said athero means artery. Sclerotic means thickening. Plaque means irregular. We can see now it was previously it was very regular, very smooth. Now it became irregular. It became like this. No, it's irregular. Artery thickening of artery causing irregularity. Right? It is matching our definition, right? Yes. Now guys, we'll write the complications, or we can say outcomes. What are the outcomes? We have plaque, right? Irregularity. This will occlude blood vessel, right? This will occlude blood vessel. When there is occlusion of blood vessel, if it happens in a coronary artery, there is risk of MI. Do you agree? Yes. Second, remember this guys, if there is a atherosclerotic plaque, there will be formation of arteries. It's good, right? Recanalization. We call this process as recanalization. These are arteries. This is good. I said no guys, any wound healing will be healed as a scar. This scar is a weakened area. When there is weakened area, there will be chance of formation of aneurysm, right? Yes. aneurysm formation. Risk of aneurysm formation. Okay, there will be risk of aneurysm formation. Guys, see, uh, here we have blood vessel, here we have atherosclerotic plaque. If by chance, if this endothelium gets ruptured, there will be this is ruptured site. If this is ruptured, this will cause thrombus. Yes, this will cause thrombus. How it will appear? It will appear something like this. Will appear something like this. What is this, guys? What is this? This is thrombus. There is a chance of this thrombus to occlude blood vessel, total blood vessel. Yes, occludes blood vessel, right? If this happens in coronary artery, this can cause angina or infarct, right? Yes, guys, this is about atherosclerosis. We'll just solve an MCQ. Okay, just hit pause button and try to solve on your own. A 56-year-old man has not seen a physician for years. He reports reduced exercise tolerance over past 5 years and occasional chest pain after climbing stairs. He smokes 2 packs of cigarettes daily. Vital signs showed BP is elevated, BMI is 30, means obese, and cholesterol 245 mg per dl, total cholesterol, and HDL, high density lipid, is 22 mg per dl. Dyslipidemia. Which vascular abnormality is more serious health risk? Medial calcific sclerosis, lymphedema, deep vein thrombosis, atherosclerosis. Which one, guys? Yes, it is atherosclerosis. See, he is a old-aged man, chest pain, smokes, and there is dyslipidemia. And there is increased BP and obese. He is obese, right? Obese, hypertensive, dyslipidemia, and old-aged man. Yes, no, these are risk factors. Atherosclerosis. I hope you enjoyed the session. If you really enjoyed, just hit the like button and subscribe to my channel if you are new. We'll see you in the next video. Thank you. Bye bye.